Hi, I'm Dr. Jason Gray with the Kineticist Sports Injury and Performance Clinic, and today we're going to look at one of the more common elbow problems, tennis elbow, also known as lateral epicondylosis. This syndrome is characterized primarily by pain on the outside aspect of the elbow directly over the bone itself and in the muscles an inch or two distal to this bone. However, in some cases, pain can actually radiate all the way down the forearm. Although pain with this syndrome is focused at the elbow, the problem actually begins with strain and overload at the wrist. You see, the muscles that act to extend the wrist attach to the hand and fingers, pass the wrist, travel along the forearm, and then attach onto the small bone on the outside of your elbow. With sports involving repetitive use of the hands and wrists, such as racket sports or golf, or with occupations demanding strenuous work with the hands or prolonged computer use, these muscles can become strained and overload, causing micro tears to develop in the muscles and tendons. At first, the damage is very small and initially is not painful. However, the body must still repair this micro trauma, which it does by laying down soft tissue adhesions in and around the injured area. These adhesions are like glue that repairs the micro tears. This repair process is a normal and necessary part of healing. However, problems occur when the motions and activities responsible for the overload continue to be performed over and over again, a situation which commonly occurs in both athletic and occupational settings. Essentially, as the repetitive or strenuous activity continues, it sets up a cellular environment of ongoing tissue microtrauma, which in turn stimulates more and more scar tissue adhesion formation in an effort to repair the area. Over time, these scar tissue adhesions can actually build up in and around the elbow and forearm and begin to affect the normal health and function of the area, creating tissue tightness, decreased strength, restricted blood flow and tissue ischemia, altered mechanics, and a loss of flexibility. Eventually, as the tissues become weaker and tighter, and as the amount of tissue damage builds up to a critical level, obvious pain and injury will develop. Traditional approaches to tennis elbow have included things such as anti-inflammatory medications, rest, ice, heat, ultrasound, laser or e-stim, or general stretches or exercises. Unfortunately, most of these approaches are limited and slow to provide relief because they fail to address the scar tissue adhesions. Remember, it is these adhesions that have caused the tissues to become tight and weak in the first place, and it is these adhesions that are binding the tissues together and restricting normal movements. Of course, stretching and strengthening exercises are also important to promote proper healing and restore full strength and function, but it is critical to first address the scar tissue adhesions. So with our approach, the first priority is to address these adhesions in and around the elbow and forearm, which we do using a specialized type of soft tissue treatment known as active release techniques, or ART. If you're not familiar with ART, you can think of it as a type of active massage. To apply treatment, we first shorten the muscle or fascia and then apply a very specific pressure with our hands as we stretch the tissues. As the tissues lengthen, we can then assess the texture and tension of the tissue to determine if the tissue is healthy or it contains scar tissue. When these adhesions are felt, the amount and direction of tension can be modified to treat the problematic area. Then, as pain subsides, exercises can then focus on restoring strength and endurance of the muscles and tendons. In our experience, although it can be complicated and a stubborn condition, with the right approach, the majority of tennis elbow cases respond very well with ART treatment, especially in combination with the appropriate home-based exercises.